So with the relaxation exercises, I think it's important to have an idea of which types of exercises tend to work better with which modalities. And it's not like a rule to say that you would only use this relaxation exercise with this modality, but in general, it may be a better one to use. So, for instance, we're going to start with progressive muscle relaxation, and that's going to be more effective with EMG than maybe some of the other relaxation exercises or techniques would be, because we're dealing directly with the muscles. So this is a procedure that goes back to Edmund Jacobson, and when he started doing this exercise, it was very, very detailed, where he would have a person, it would take a long time to go through it, and it would take a long time for people to learn how to do it, and the exercise took a lot of time. So I think these days most people are not going to spend that much time, and so people have come up with more abbreviated versions of it, where you can, everything all the way to where you're just kind of scanning your body for areas of tension, whereas he was having people contract muscles starting at, with very minimal amount of contraction and different levels of contraction, and relaxing to really get very aware and sensitive to different levels of tension in the muscles. And as people got busier and their attention spans got shorter, and people are just not as patient, they started to abbreviate the exercises. So what he saw was that patients maintain tension not required to perform a task. So you might be tensing your muscles unnecessarily while you're doing something, and you do it because you don't notice that you're doing it. It just gets to be a habit. So the more that happens, the more it can develop into a problem. And the EMG is able to detect the muscle tension very easily, as you can see from our practice and demonstrations, that in some cases you may not have been aware that there was much tension at all in a muscle, and even when you did a movement, it may not, you probably wouldn't have expected the reading to change as much as it did sometimes when you did certain movements. So it helps us to be a lot more aware and to gain sensitivity. Another thing is that the muscle bracing wastes energy. So if a person is constantly tensing their muscles all day, that can be using up energy. And then we talk about it in athletics, where you, in many cases, need to be able to contract your muscles a lot for a period of time. But then after you finish doing whatever you're doing, you should be able to rest those muscles until you need to contract them again. So it's something that can be helpful if a person learns to be more aware, release the tension when it's not necessary, and also disrupt performance and produce stress disorders. Anxiety also can be related to muscle activity. So if you're contracting muscles, it's almost like a loop where you can be stressed in your mind, and so your muscles tense up in response to that. But then by your muscles being tense, it's like it sends signals back to say, there's a problem, and just maintain that level of tension because we need it for some reason, even though we really don't. So there's definitely a relationship between stress disorders, anxiety, and muscle tension. And sometimes you can have a problem, somebody's thinking about something that's a problem, and all the time they're thinking about it, they're holding tension in their muscles. So here's what he was having people do. So he would have the person relax 2 or 3 muscle groups each session until 50 groups were trained. So you imagine, we were talking about biofeedback sessions where a person has to come once or twice a week or something, and the session is however long it is, 20 minutes, 30 minutes, 40 minutes. He was having people just focus on 2 or 3 muscle groups per session. and you had to cover 50 different muscle groups. So you can see that would take a lot of time.
50 to 60 sessions?
Yeah.
No one would ever do that today.
Right.
What kind of results did he get? I mean, how
Well, he got
can you
great
go?
results.
Well, what
but-
kind of results? Like, people are just don't have tension in their muscles? That doesn't...
Yeah, well, with symptoms like, for instance, headaches and pain and so
Right.
on, and he got relief with it, but it was very meticulous, you know, and here it says,
Did they get a prize?
1 to 2 daily 1-hour practice sessions. So sometimes we're struggling with trying to get someone to do practice for 20 minutes a day or every other day.
Yeah.
So you can imagine that this could be pretty difficult. And this is nice to know. Studies do not show a difference in outcome between the original protocol and more condensed version. So that's the good news. That, you know, even if you're not going to do it the way he did it, you still tend to get results that are good enough.
Yeah.
So basically, it has to do with the tensing and relaxing muscles. And what that's doing is focusing your attention on the muscle. So if I'm not thinking about my right shoulder, I might be holding some tension. I don't have to have it all the way up here, but maybe instead of it being here, it's kind of here.
Mm-hmm.
And so I'm not thinking about it, I just go along doing whatever I'm doing. Now, if you tell me to tense my right shoulder, I tense it, and then you say relax. Now, I relax it, and it tends to get to a more relaxed level than it was before, because my awareness kind of zooms into that area, because I can feel the muscle as it contracts and as it relaxes.
That reminds me of something about my shoulders.
Yeah, we work together in the office, so sometimes, you know, she'll be talking to me, and I'll see, you know, she's talking like this, and I'm like, shoulders, and then she does that, you know. That's what I feel like doing when I'm, you know, I see people out and they're intense in their job, but I don't tell them. I feel comfortable enough to tell her because we work together, but, you know, strangers might react a little different. So, it just brings awareness, and you can, you know, rather than having the 50 to 60 sessions and so on, what I usually do, because I know how people's attention span is, and you know, everybody's so busy and all, I just want to get people to be more aware just in general. So if you know that when you get stuck in traffic, you get tense, you get stressed, then just not the whole ride, of course, but if you think about it, you just want to think about, okay, how tight am I grabbing the wheel? And if you're doing this, then you just actively relax the muscles in your hands, or if you notice that you're holding your shoulders up, then you just relax it at that point. Not that you have to be, okay, I gotta tense my toes, and I gotta tense my, you know, my calves, and I gotta tense my thighs, and then, you know, you're not gonna have time to do that all the time, but it's almost like a scan of your body, just saying, okay, you know, I feel tension in my jaw, relax that. Because if you've done the practice of the, you know, tensing and relaxing throughout your body before, then you have a sense of how it works. Then it's more of a matter of just noticing if you have tension in a certain area and releasing it. But then there is a benefit to doing the whole practice where you're tensing and relaxing the different muscle groups, because that helps you to build up that awareness of what it feels like when my leg is tense, or when my shoulder is tense, and so on. Because you've done it before, and it just gets to be more of a sensitivity to differences in levels of tension. So passive relaxation is more where you're just noticing the feeling of the muscle and whether it's tense, and if it's tense, then you release the tension at that point. And after the person was able to eliminate the residual tension, then he was encouraging the patients to develop the skill of differential relaxation, also inhibition of unneeded muscle groups during routine activities. So you might ask someone, for instance, to thread a needle and see, you know, want to make sure that they're not tensing muscles in their leg or something like that, which, you know, you might do if you're not really trained in the differential relaxation. So some of the important differences you want to notice are whether muscles should be tensed or passively observed. So that's where you're either actively tensing the muscles and relaxing them, or you're just kind of noticing whether there's tension in the muscles. The number of times a muscle group should be tense, that can vary. So again, if you might decide that you want to have a more detailed exercise, progressive muscle relaxation exercise, or a more abbreviated one. So if you want to be more detailed, you might ask the person to tense the muscle and relax it, and then wait for a while, tense the same muscle again and relax it. And you might have them repeat it 3 times, or you might just have them do it 1 time. That's something that you can decide, how you want to do that. I'm guessing probably most of you are going to do it 1 time. But that's what I do. I don't do 3 times. I just like to be efficient. The muscle groups that are trained. So one person might have you just tense your toes in your left foot and then relax them, and then bend your foot back so you're tensing bending where the ankle is and tensing those muscles, and then tensing your calf muscles, and then tensing your thigh muscles, on the left side, and then separately doing the right side. Another person might decide to just do left and right at the same time and relax. And rather than doing different parts of the leg, they might just have you try to tense your whole leg at one time. So there's variations that you can kind of just decide how you want to do that. And there are different scripts that will have specific procedures on how to do it. And you can either use one of those or you can modify it. And the order that you do it in, so you might start at the feet or you might start at the head. I usually start at the feet and go up, and you want to also tense the muscles in the face too as part of it. So the environment, can vary. If you're in your office, you might, have the lights turned down and things like that. For the most part, I like to have people practice in more normal situations. So, it's nice to have a sort of, artificial environment, where you can feel super relaxed and you're like, it's almost like a break from the real world and all that. And that's good to do, but I think generalizing to what people usually have to deal with is important. So if you're going to have these sort of artificial environment set up, I think you still want people to be able to do the practice, wherever they are, or at least have some version of it. So you should be able to, if you're sitting on your couch or if you're sitting at your desk in the office, you should still be able to do the exercise. Now, some things you're not going to be able to do in the same way when you're around people. So, I might be in a meeting and, you can't really do a full relaxation exercise, but you can still be scanning your body and noticing if you have tension in a certain area. One of the things that I do when I go to the dentist is I will kind of practice the scanning of my body to see if I'm tensing any muscles. And it never fails, in all these years I've been doing biofeedback and all. I'm still finding that I'm tensing some muscle, even if I'm getting a cleaning. It's just that sound,
Exactly.
And so I'll notice, okay, I'm starting to make a fist, and I relax that, and then I notice, okay, the toes on my left foot are starting to curl up. No, I got to relax that, and by the time I go through all that, then I'm done. So, but it's almost like a game. We're just trying to say, okay, these muscles have nothing to do with what's going on in my mouth here. So, I should be able to keep my leg relaxed while this is happening. And for the most part, I can do it, but I do catch myself. And like sometimes when I'm training people, they get upset. It's like, oh, I keep finding that I'm tensing my shoulders or whatever. I said, but you are noticing that you're doing it.
Yeah.
So if we were monitoring, let's say we had a Holter monitor and we were monitoring it 24 hours before you started learning this stuff versus now, there would be a difference. So maybe your average would have been, let's say, 10 microvolts, and now that you're doing this, even though you still find that you're tensing, when you catch yourself, you relax the muscles. So maybe now it's 6 microvolts, and eventually it'll continue to improve. So it's a lot better than it was before you had the awareness. So here it's saying for a conventional protocol covering 16 muscle groups, the patient might tense for 7 seconds and relax for 45 seconds. And even this is a little bit longer than I might do. So if you're doing 16 different muscle groups and you have the person tense for 7 seconds and then relax for 45 seconds before, especially if you're going to repeat any of them, then before they go to the next muscle, it's still going to take a while. So I might even go a little shorter than the 45 seconds on the relax before you go to the next one. But it just shows where you're trying to get them to feel the difference between the two states, the relaxed state and the contracted state of the muscles. And you also want a person not only to be able to feel the difference between when the muscle is totally relaxed versus very tense. You want them to be able to notice the beginnings of tension. So if I have my shoulder relaxed, I want to be able to notice the difference between this and this, as well as the difference between this and this. Because usually you're not going to walk around like this. It's going to be somewhere in the middle, but it's going to be enough to develop. I think I'm triggering.
I know you are. My shoulders are like killing me right now.
But you can think, if you hold it partially up for a long period of time, that's enough to trigger the pain. I used to do a lot of tech support on the phone, so I'd be holding the phone like this, and talking to somebody that was doing biofeedback, and the equipment wasn't working right, and I'm on the phone trying to help them figure out the problem, and I might be on the phone for a half hour, 45 minutes, and I might have 2 or 3 of those calls during the day. So when I got home at the end of the day, I was like that. I had some pain there. So I 2 things I did. One is I started using a headset. It works better. And the other thing I did is I would put an EMG sensor on while I was on the phone with somebody. So I would see, as I'm talking to them, all of a sudden the reading is starting to go higher, and then I would remember to relax my shoulder if it was going up. So, a lot of it is really just developing that awareness. Let's see, you also want to make sure that you're not causing the person more pain. So if they've got an injury or they've got pain in a certain area and doing the muscle contraction in that area is going to be painful, you want them to either back off on that and maybe not tense as much, or even just skip that area if it's going to be too painful. Because again, you don't want them to walk out worse than when they come in. If there's an area that seems to be a bit more resistant or more difficult for them, not because they have a lot of pain, but just because they're having some difficulty with the tensing and relaxing and feeling the difference, then you might repeat that. All right, so that's the progressive muscle relaxation. Then autogenic training is something that's...
Sorry, I have
yes.
a question about that.
Sure.
So have they shown that with progressive relaxation it leads to general relaxations, that it does eventually affect not only EMG but also skin conductance, temperature, HRV, etc.?
Yeah. Now it's not going to necessarily have the same effect for everybody, but in general, there's crossover in the different relaxation exercises where it'll benefit the other modalities. I'm just saying that, like, for the relaxation exercise that would be the most specific to EMG would be progressive muscle relaxation. But if I had somebody practice progressive muscle relaxation, it would most likely help them also, let's say, to increase their hand temperature and things like that, because
Are there studies that differentiate, that compare the different relaxation methods?
Off the top of my head, I don't know, but it's something that I could check on. I'm pretty sure that there are, there is documentation for it. I just don't know the studies to cite.
Yeah, I'd be curious, like which ones really lead to a deeper state of relaxation.
Even in other words, the different relaxation techniques, and is there like one that seems to be in general best? I'm not sure. Usually, in biofeedback, usually people are using various relaxation exercises, and some of them just seem to have more of an effect in one area versus another. So, specific to temperature. And that's partly because it involves the imagery that has to do with warmth and heaviness. And it tends to contribute to the hand warming and increased blood flow to the hands and feet. So this is also a very old technique. And you'll see that there's a couple of people there that were involved. You have Schultz, and then you have Luth. I think that's the correct pronunciation. And so you have, there's deep relaxation and falling asleep that are associated with sensations of heaviness and warmth in the limbs. So they talk about the arms and legs being heavy and warm as part of the imagery. And it tends to produce a relaxed state. So temperature training, about like with EMG, it seems like you can relax the muscles and maybe not be as deeply relaxed as it might take to increase the hand temperature. And so, you know, this is a different technique that is to kind of encourage that level of relaxation that would increase the hand temperature. Often, go ahead.
I was curiosity, thinking about neurofeedback.
Mm-hmm.
I know we're going to get more into it later about the different waves.
Mm-hmm.
Have they done any like exploring of, like, if you do progressive muscle relaxation, it activates more of a certain type of wave. If you do autogenic, it's more associated with certain types of waves. So I'm thinking to try to understand how it works. And so if it's related to our brains and our neurophysiology, have they explored which ones are more likely to trigger certain brain activity yet?
I'm not sure. Someone to just trying to use the stuff that I have available to me that sometimes I forget about, trying to figure out what people
It's better to be in the moment and just do it sometimes.
But it's an interesting question. I would imagine, like, for instance, with the autogenic relaxation, it probably, and especially that it's involved with hand warming, and what we talked about with the substance abuse protocols, and that they wanted people to get to 94 degrees and be able to maintain it for 30 minutes, that alpha and theta would be increased during autogenic relaxation. Probably not as much during progressive muscle relaxation. And part of the reason why I would think that is that the progressive muscle relaxation, you're probably not going as deep because you're involved in doing more mechanical things during it. So if I'm thinking about tensing and relaxing this muscle followed by the next muscle followed by the next muscle, I'm probably not going to go to as deep a state as if I was doing what's involved in the autogenic relaxation. So that's between those two, I would say more likely you're getting into a deeper state with the autogenic.